How's it going, guys? We have a pass level question for micro/path. 23-year-old woman, she has squamous cell carcinoma. You need to know that intercellular bridges, keratin pearls, highly buzzy for SCC, and this can be any type of SCC. Pulmonary, can be the skin, okay, it doesn't matter. All SCCs in USMLE. And then we've got this image here, which is showing us schistosoma hematobium. Okay, now you got this terminal spine as well, sometimes helminthic infections. It's a trematode we have here, which means a fluke. These spines can be at different locations, all right? Now, schistosoma hematobium causes squamous cell carcinoma of the bladder. Choice D is our correct answer. Very easy, very pass level, okay? Now, transitional cell carcinoma of the bladder is smoking, as well as industrial dyes, aniline dyes, 2-naphthylamine shows up on USMLE, but schistosoma hematobium, schistosomiasis, causes squamous cell carcinoma of the bladder. They'll tell you a 23-year-old girl went backpacking in Africa, was swimming, now has red urine. It's literally that simple. The schistosoma hematobium will lay its eggs in the bladder wall, and the cystic veins draining the bladder, and they can calcify and they can be granulomatous. Just some extra information there. Schistosoma monsoni and japonicum can cause portal hypertension. All right. So let me just tell you some high points about the others. Consumption of bear meat is wrong. This is going to be Trichinella spiralis, trichinosis. This is pork nematode, okay, which is a nematode's a roundworm. So bear meat, ursine means bear, as well as pork. You can get Trichinella spiralis. Okay, but this is up in Alaska. Alaska is the United States. Okay, so trichinosis presents with a triad of periorbital edema, myalgias, muscle pain, and fever after patient ate pork or bear meat. Wrong fucking answer. Choice B, and you can use bendazoles to treat, like mebendazole, albendazole, and for schistosoma hematobium, use praziquantel classically. Choice B, consumption of fish is wrong. Diphyllobothrium latum, that's going to be your pork. Tapeworm, cestode, okay? And that can also cause B12 deficiency. What I do not want is you memorizing that Diphyllobothrium latum causes B12 deficiency, and then you get questions on pernicious anemia wrong on USMLE, okay, which is antibodies against parietal cells causing B12 deficiency. So you don't want to miss the forest for the trees, memorize obscure stuff, but not know the high yield stuff. Wrong fucking answer. Choice C, consumption of pork is wrong. So we said that could be Trichinella spiralis. It can also be Tinea solium, which is pork cestode, pork tapeworm. So Tinea solium causes cysticercosis. It's going to be cysts within muscle pain, and it can cause neurocysticercosis, which is cyst-like structures in the brain. They can give you head CT or MRI, and it will look like Swiss cheese. That's classic. They can give you a singular lesion where it doesn't look like Swiss cheese, and then they can give you another image where it looks like soap bubbles within the ventricles of the brain. I've seen all three on NVMe, and you can treat this with albendazole, the neurocysticercosis, or praziquantel for regular muscle cysticercosis. Regardless, wrong fucking answer. Choice C, walking barefoot's wrong. So this is going to be your hookworms. All right. So this is going to be Ankylostoma duodenale, Necator americanus. Those enter through the feet. They crawl up into the lungs. They go through the blood up to the lungs, and then the eggs in the lungs hatch. They crawl up the trachea, and then they're swallowed down into the GI tract. Very like fancy, obscure mechanism for how they get to the GI tract, but USMLE wants you to know it, and they'll have this as an answer, just like through the feet, walking barefoot, and they cause microcytic anemia because they suck the blood from the GI tract. Strongyloides stercoralis is another one that it's another nematode. Okay, as are the hookworms, nematodes, roundworms that enter through the skin, through the feet, but it's not, Strongyloides stercoralis isn't technically a hookworm. And you treat these with bendazoles as well, like mebendazole, which is a microtubule inhibitor. Praziquantel causes worm paralysis. Wrong fucking answer.